My name is Robert Cartland. I'm an engineering physicist and I live in Southern California. And in the late 90s, around 2000, I was suffering from numerous health problems. I didn't necessarily think they were related, but I just went to the doctor for different things. But the main problem that I was struggling with was basically just sort of a chronic overall fatigue. I had I also had sinus problems. I had rashes. I had things that were kind of peculiar. I would have face twitches, sometimes just muscle spasms, things like that. I also had some emotional problems. I was suffering with depression. I was feeling tired quite a bit and fatigued. And it wasn't something that happened overnight. It was just sort of a gradual process. My health was sort of decaying. I had heard a bit that there may be some possibility with the mercury in dental amalgam. So I went and consulted a dentist who told me not to worry about that. So for about 2 years, I just sort of dismissed it and sought traditional medical treatment, alternative medical treatment, and in some cases, psychotherapy kind of thing. Mostly just talking analysis. Nothing really seemed to come together. I just kept getting worse. I assumed I needed to maybe take a break. I had been working pretty hard, so I started to sort of take some time off to deal with the fatigue, and I kept getting worse. I just kept getting sicker and sicker. And then in about the beginning of 2002, I decided to really look heavily into the possibility that maybe the mercury from my 8 amalgam fillings were making me ill. And I assumed that there really wouldn't be much research on the subject, that since it was controversial, that would mean there was really little or no information. And I was surprised that there really had been hundreds of peer-reviewed studies on the subject. There was some controversy, but there was also a lot of evidence showing that the mercury came off the fillings, entered the body, and at least some testimonies that people were having their health improved. So I thought, I looked into it further. The book that I primarily used was a book by Andy Hall Cutler, an amalgam illness book. And he's a chemist and a chemical engineer, so his style of writing kind of hit me the right way. I'm also an engineer, and it came across as pretty commonsensical, practical, and he had a diagnosis criteria based just on symptoms, and I never really related things like the sciatica I was suffering from to seasonal allergies, to the skin rashes. I didn't think they were related, but they all, when I looked at his diagnosis, I came out something like 99% positive for relationship with mercury. And that included some routine blood tests that I had done from my doctor, including he was doing things like thyroid tests for their fatigue and that kind of thing. So, so based on that and based on limited resources, I just used my financial resources to replace the 8 molar amalgam fillings that I had with mercury-free alternatives. I did them 1 quadrant at a time, spread them out. Before that, I started, taking antioxidants, lots of vitamin C and vitamin E, also taking fatty acids, fish oils, and omega-3s. So I did start treating myself with supplements, including glutamine to help get my glutathione. I remember my experience with glutamine was just amazing. The first time I took it, I just got this tremendous amount of energy. I think I was up for about 16 hours, just really felt a lot of energy, and it seemed to indicate that maybe my glutathione levels were low. So I pursued that course. And also as an engineer, I kept notes every day. I kept track of the symptoms I was experiencing. I rated them on a scale of 1 to 4 and kind of saw which ones were coming and going, because with all the amount of information that was mostly kind of internet-based and some peer-reviewed studies, I wanted to see what was helping me, what wasn't doing anything, and what was maybe making me feel worse. But I did note that as I got each quadrant removed, for maybe a week or two, I'd feel a little worse, but then I'd get a little better than before I'd had them removed. So it was a kind of a cycle of feeling worse and then getting better than before. And noticing gradual improvement. I also would monitor some of the symptoms at once a year. So after I got my amalgams replaced, I would monitor the symptoms once a year and notice that, wow, I don't, after a couple of years, I don't have seasonal allergies anymore. I don't have ringing in my ears. I don't have the skin rashes are gone. I don't have the twitching in my face and in my muscles. And it took about a year. In the middle of 2003, I began working full-time again. I started off doing contract work, and in 2004 I got a full-time job for my current employer. So my health really turned around, and I just over the course of years, maybe not every year, but every couple years, I would go back and just look at the symptoms and say, wow, I'm really, a lot of these symptoms I dealt with are pretty much eliminated. Now I still try to take supplements. I don't need to. I often go many weeks and months without supplements. I'm working full time. I have, during that time period, also had 3 daughters and raised a family, so I've been pretty active just with my family. I haven't been that involved with the anti-amalgam type of movement until recently. I just was living my life and was recovered, and pretty much thought that this was something that was going to grow in awareness, and more people were just going to discover that, boy, there's a toxic substance in fillings that fewer and fewer people will be using it. I know that when I first started looking into it, I believe anywhere from 80 to 90% of the dentists were still using dental amalgam in their practice. Now it's down to 50%, so it is going down. It's going in the right direction, but there's still a lot of misinformation. There's still a lot of statements made that it is perfectly safe for everybody. Now, as a scientist and an engineer, I've looked at the peer-reviewed literature, and it seems almost illogical to look at the peer-reviewed literature and make the claim that they're safe for everyone. There may be many people, even a high percentage of people, that have these type of fillings in their mouths for years and live a reasonably healthy, productive life, and don't suffer any health problems from them. But to say that you can release mercury into people's bodies and it doesn't affect anybody seems a bit irrational, and that's the stand currently taken by the American Dental Association. Although they do admit that a few people have some allergies, but they continue to claim that there's nobody suffering from a type of chronic illness, a long, slowly developing illness like I experienced. In 2003, there was one of the first peer-reviewed studies, I think 700 or so patients that had amalgam removed and noticed symptom mitigation and improvement. Since then, there have been 4 more studies of different sizes, but all of them report the same thing. People that have their amalgams removed and replaced and have this sort of numerous health problems do get better. And in some cases, 70% do get better. And some of those studies were controlled studies. In other words, they had a group that removed their amalgam fillings and another group that didn't remove and replace their amalgam fillings, and the group that went with removal had a much higher probability of symptom reduction. So I think now people are beginning to realize it. The FDA is reconsidering its position on dental amalgam. That more and more it's a substance that, one, is harming some people. There is a susceptible population that is being clinically harmed, or whose health is being impacted by amalgam. And B, there's almost no way to determine who those people might be, who that sensitive subpopulation might be. So every time a dentist places an amalgam filling, they're effectively playing roulette with someone's health. They don't know whether they're going to be sensitive or not. And I think that's a problem that needs to be addressed in our society. Even in countries that have banned amalgam, like Sweden, they still have commissions that report that the medical community and dental community, patients still feel like they're being treated with sort of a nonchalantly in terms of their care. And there's a lot of ignorance in terms of how to test if someone's suffering from mercury poisoning, how to treat it, how to properly remove the fillings. Although there's IAOMT protocols in place to do that, there's still some variation in terms of how it's treated, and society needs to wake up, deal with the problem, look at the facts, um, look at things rationally and scientifically, and say, yeah, this is similar to some pharmaceuticals where some people have side effects. This is a material that, since you cannot determine who may react and who may not, should no longer be used because there are safe and effective alternatives. Um, and right now we need to really deal with those patients that are suffering from this and help them get treatment and help them get awareness, and also help the dental and medical community gain awareness in a very rational, scientific sense. It's a very passionate debate. People on both sides have a lot of strong emotion, and it's been a strongly emotional debate since before the Civil War. But this needs to be dealt with, and dealt with the sooner the better.
How did you end up with so many amalgams in your, where did you live? What kind of, was it, were you insured and that was the only option? It was the only option in the market at that time, I suppose?
I think those 8 amalgams, I mean, very few people really remember all their dental history, but I believe those 8 amalgam fillings were placed when I was a teenager. So I believe I was about a sophomore or junior in high school at that time. And I wasn't aware there was mercury in the fillings. I didn't know there were any other types of fillings. They were in the molars, so this would have been in the 80s, and there was some awareness coming out, but not. I don't believe that even that 60 Minutes broadcast came out until 1990. So the controversy was limited at that time. There was no IAOMT at that time, I guess, so it would have been kind of when the debate was just getting started, and so it was just the traditional standard treatment was to get amalgam fillings.
And you were 18 then, and then what I want you to do is tell me that, at 18 you had them, and then what age, how old were you when your problem started, and then
right.
How much time it took you to give me that chronological line, please?
Well, it's hard to say if I felt immediately less healthy, but what is almost certain is that it took many years, and my health gradually declined. So it wasn't an immediate reaction.
How old were you when you started?
I would say in my mid-20s is when I started having health problems. I started going to the doctor and having MRIs done for headaches, that kind of thing. I started to develop the allergies. So, and it was relatively healthy, but some of the other symptoms I started having, including the chronic fatigue, would be something like just dizziness when I would take a shower, dizziness when I exercise, so exercise intolerance. I would describe it as feeling like I was run over by a small truck. And at my worst state, I was essentially in bed 2 days a week. I couldn't get out of bed. I would literally look at the ceiling, and I would have I had 2 little dogs at the time. I would look at the ceiling and I would wonder, what would I do if the house was on fire? Because the only thing I could think of is I would have to get up because I would have to save my dogs, because I was just unable to get out of bed. 2 days a week, I probably felt well enough okay to interact, to go out and take care of myself. The other days was sort of in between. But by my threshold, by my standard today, the good days would be considered not so good by today. I also had a lot of emotional problems. I would lose my temper. I would get into fights with people in a parking lot. And it was almost the impression that I was looking at somebody else. It was like, that's not me. Why am I getting so angry over this? I had little control over my emotions. Just feeling awful all the time. They said I had this sciatic nerve problem and just feeling in a lot of pain and discomfort. So it was a gradual thing. They were placed in my teens. I started having problems in my 20s. And it was in my 30s that I reached bottom. I hadn't worked for a couple of years. I looked into the amalgam, had them removed and replaced, and then it took a year of recovery. So it was not an immediate reaction, except it's very clear that once I had my amalgams replaced with mercury-free materials and treated myself for mercury poisoning, I followed the chelation protocol that Andy Cutler developed, which is a frequent dose chelation of alpha-lipoic acid, and later I added some other chelators. But I started off basically for economic reasons, just using alpha lipoic acid. And as I said, within a year I was working again. I wasn't working, I was getting job offers and opportunities to work, but I just kept thinking, how am I going to do this if I can't get out of bed 2 days a week and not know when I'll be healthy and when I won't be. So it was a struggle, and it's still impacting me financially. It resulted in a lot of debt and a lot of difficulty.
And how old are you now? Like from your 30s that you took care
So
of?
it's been 10 years. So I'm in my 40s now. So it's been
Could you
10
say that
years.
again for me, please?
It's been 10 years. I'm in my 40s now. And when I testified to the FDA, I did show them, you know, a PowerPoint where I've been tracking the symptoms over 10 years. And since I had my amalgams removed, I have fewer and fewer, and essentially all the symptoms are gone. 2 or 3 that I were tracking, including elevated serum lipids, I don't think had anything really to do with my amalgam. And a little numbness in one toe, I think, was caused by a back injury. So I was tracking different health problems, and I was like, wait a second. Tinnitus. I had never heard of the word tinnitus. I thought everybody had ringing in their ears. I thought it was a normal condition. I went to a presentation by Dr. James Rhoda, who's a mercury-free dentist and is also contended with mercury issues. And I said, oh, doesn't everybody have tinnitus? I thought that was something everybody had. And that's gone. The seasonal allergies are gone. The rashes are gone. I can take a shower without feeling dizzy or fainting. I can exercise. I exercise regularly. I don't need to take supplements. So I'm lucky. I'm one of the lucky ones that pretty much fully recovered. I still have some emotional issues. I still get a little, I don't have the outbursts, uncontrolled anger, but
Do you know what your ApoE is?
I don't know that. I do have a great-grandfather that did suffer from Alzheimer's disease, but I have not, mostly financially, I just didn't have the resources to pay for a lot of expensive tests.
So tell me a little bit about the health history of your family. Like how many kids, and did you all get amalgams? Did they all, you know, are they suffering from anything that you suffer now? You come from a big family?
I don't have a brother who does suffer from seasonal allergies. I don't believe he had amalgam illness. I do have a unrelated stepsister who had paralysis in her face that was gone after she had her amalgams replaced. I have a grandmother who comes from a family of 3. She is sharp as a tack at age 80. She only had gold restorations, and then when her teeth gave her problems, she actually had them all removed to get dentures. Her sister suffered from numerous health problems and had a mouthful of amalgam. So many debilitating health problems. The rest of my family, I do have a history of heart attacks, but they were also both my grandfathers had problems with heart, but they also drank a lot, smoked a lot, and so. But one thing I do share the Northern European ancestry. I have relatives from Sweden, from Germany, and some of those countries that have banned mercury. So I do share the sort of heritage of some of the countries that are most concerned about mercury.
And then lastly, what would you say to someone that is listening to these, that either have amalgams right now, have had some of the symptoms? What would you say to them? What would be your advice or suggestions to them?
There's different groups of people. There are some people that have amalgams that have no symptoms, and then they're concerned. Is it going to affect their fertility? My wife fell in that category. She had a couple of amalgam fillings, no real symptoms, but we were in our 30s and started thinking about having a family. We wanted to wait till I had chelated and gotten the mercury out of my body, but we didn't want to wait and try to have kids for 3 or 4 years and then say, well, now let's take the amalgam out and be in our 40s not trying to have kids. So she had her amalgam fillings removed. So I think if you're thinking about having children, deal with the amalgam before you start to have a family. That was our decision. And we didn't have any fertility problems. We were able to have 3 kids fairly easily. What else? So that's one category. And the other, there's this relationship to maybe cardiomyopathy, heart problems. So somebody who doesn't have symptoms really needs to take their time, do the research, look into it. If this is if they're watching this video and this is their first experience with this issue, let this be a starting point. Look into it carefully. The removal protocols, there's an IAOMT protocols for having fillings replaced, but make sure you find a good dentist that you're comfortable with. That's the first thing. You don't always get what you pay for. I had quotes to treat my fillings for something like $50,000. I had dentists wanting to do all sorts of ancillary treatments, including getting my jaw casted and things like that. But I found it very reasonably priced. It was less than $2,000 for me to have my fillings replaced with composite. So you don't always get what you pay for. So don't rush into getting your fillings replaced. Look into it deliberately, carefully, and do your homework. If you are suffering from the health problems, I definitely recommend Andy Cutler's book. I started feeling better with some of the nutritional supplements, the antioxidants, and 4 main types of supplements. Antioxidants like vitamin C, vitamin E, B vitamins, lipids. Mercury destroys the lipids on the cells, so if you take omega-3, omega-6, fish oil, flax oil, take a lot of flax oil. Some amino acids just made me feel so much better. Glutamine in particular. I also took glycine, but glutamine really made a big difference. So those 3. And then minerals. I also supplemented with certain minerals. I thought it was pretty crazy thinking all these different pills, but I wasn't feeling well, and like I said, I kept a health journal, and I'll try it and see, and certain things definitely made me feel a lot better. Some things maybe didn't make much difference, and one thing, I think methionine really made my heart feel worse. Oh, that was the other symptom. I used to have angina. I don't have angina anymore. I used to have pains in my heart, and that's gone. So there were just numerous symptoms that I traced through the years.
What was the name of the book by Ann Cutler? What is it
Oh,
called?
Andrew Hall Cutler. It's called Amalgam Illness, Diagnosis, and Treatment. And it's a self-published book. He's a PhD chemist. He's Dr. Cutler, but he's really a chemist in I believe in Seattle, Washington. He's also very approachable through emails and very helpful through Yahoo groups and that sort of thing.
So if you want a copy of this book, you contact him?
Yeah, it's also, you can get it on Amazon.com. So it's available. The other question was, people who are suffering also need to take things a little slowly, and they also need to learn how to remove the mercury from their body. They need to understand chelation protocols. Some people have been really harmed by overly aggressive, including intravenous IV chelation. That needs to be done carefully. You need to understand chelation protocols, and also understand that what might have worked for me or another person might not apply to you. People do, biochemistries are different. Some people have to contend more with thyroid problems. Some people have to contend more with gastrointestinal problems. I did not have those problems, although I did have below average body temperature for a while. It seemed to be maybe thyroid related, but I didn't have to go on thyroid medications and that kind of thing. So mercury is a subtle toxin. It's a cytotoxin. It kills cells. Its effects are dependent on individual biochemistry. There's all sorts of symptoms. This is not debated. This is in the toxicology profiles for mercury. It's known to get into the body. They don't know how much it accumulates. They know it gets into the brain. It affects the nervous system. It affects the autoimmune system. It affects numerous systems in the body. So you really have to, I would say, keep a journal, learn as much as you can, and don't be afraid to do something, but do your homework, read as much as you can, talk to as many people as you can, and learn as much as you can.
And of course, please don't rush out and just have your mercury fillings taken out anyhow. I think that's important to say.
Don't rush out. Definitely don't rush out. The decision to have your amalgam fillings replaced I think I respect that individual make that choice for themselves. They have to do the homework and make the choice for themselves, and have to be aware that when they do remove them, they are going to release a lot of mercury into their body. Depending on how they're drilled and taken out, that can be significant, so they have to be aware of that. That I was an attendee at the FDA hearing in December, and I found it interesting as a scientist and someone who's interested in debate. that there are two sides to this coin, and they're very passionate. And there are some people that have looked at the science and have really determined that they're safe and effective. And I don't believe that there's this grand conspiracy. I do believe people look out for their economic interests, and I do believe there's a fear of litigation. But I also believe that people sincerely have looked at the science, have seen some of the peer-reviewed studies, the New Zealand study of 20,000 people that didn't find an effect connected to amalgam. There have been studies of children. But what you can really conclude, and you can also conclude that the levels coming off of fillings do not exceed those levels that cause illness, that are known to cause illness among adults. And then they do these studies by looking at people who work in factories. They work with mercury in chlor-alkali factories, in light bulb factories, or in mining, in gold mines. And they say, well, you know, we have these adults, and we know this level makes them sick. But the criteria is they get tremors, ataxia of gait, they have slurred speech, definite signs of neurological damage, and that level is considered toxic. And then they have to put in a safety margin, because those same levels have to be applied to people who aren't healthy, adults who aren't healthy, who may be genetically susceptible to mercury, so they're not going to work in a mercury factory, because like they start getting sick, they're going to quit that job. It also has to be applied to children. It has to be applied to pregnant women. It's applied to fetuses and developing embryos, who are, of course, many orders of magnitude lighter than an adult working in a factory. So they have to apply that. So they apply this margin of safety called an uncertainty factor, which can range from 30, which is what the EPA currently uses and the FDA uses. Some countries recommend 100 in Canada. So the state of California makes that safety factor 300. So when you look at this unknown sort of fudge factor that they put in there, you can see that in many cases the amount of mercury released exceeds those safety limits, which means there's a possibility that at least some people are affected. You can also read the peer-reviewed studies that show mercury to be safe, that don't cause clinical problems, they cause definite subclinical problems. And at the FDA hearing, one of the neurologists, Suresh Katogo, mentioned that by the time you see the type of neurological problems that the EPA has looked for, that the studies looked for in people who work with mercury, the tremors, by the time people start showing that, they've already done a lot of neurological damage. So the fact is, a lot of people are suffering, well, the studies show that there are a lot of subclinical effects. There's hearing loss studies. So there's a lot of scientific evidence that there's these subclinical effects. So in terms of the debate, I guess if you side on the side of mercury, you can say, well, there's probably just a small number of people affected. And even some of the dentists at the FDA panel said, I support the continued use of mercury, but I'm concerned about this susceptible subpopulation. And that's where we are today in the science, that there seems to be a growing consensus that there is a susceptible subpopulation. So it's not, so this idea that, well, there's these anti-mercury, anti-amalgamists that thinking mercury fillings are killing everybody. No. The debate is, we believe they're hurting some people, a small percentage of people. The people who are for amalgam keep arguing that it's not hurting anybody. So the debate is, on one side, you say people are getting exposed to mercury, but nobody's getting chronically ill. And the other side is saying people are exposed to mercury, and there's some percentage is getting chronically ill. And that's where the science stands right now, and that's what the decision that the FDA said today. They promised to make a decision by the end of 2011 regarding their revisions to their current policy on dental amalgam.